Gestational diabetes can affect pregnant women, and it can have a major effect on both mom and baby's health if it is not controlled. We sat down with a local mother who was diagnosed with gestational diabetes early in her pregnancy. She says it's been a life-changing journey, but one she hopes will help her live a healthier life for both her and her baby. This is not one of Brenda Jaramillo's OB checkups. This is one of her routine visits to the Community Diabetes Education Center. The 29-week pregnant mom-to-be was diagnosed with gestational diabetes.
At 15 weeks, when I got that call from my OB's office that you're diabetic. Denial? No, I don't eat sugar all day long. That's what my initial thought was. The person who's diabetic, especially in pregnancy, you're eating really bad food. That's not me.
Most pregnant women aren't tested for gestational diabetes until 24 weeks. But Brenda says her OBGYN suggested she get tested early because she had risk factors. Registered nurse Patricia Calderon explains.
Risk factors, obviously, women that have had diabetes in a previous pregnancy. If your BMI or the weight is higher weight before the pregnancy, family history of type 2 diabetes, and of course people with certain ethnic backgrounds are at higher risk as well.
According to the American College of Obstetricians and Gynecologists, those ethnic backgrounds most at risk of gestational diabetes are African Americans, Asian Americans, Native Americans, Pacific Islanders, and Hispanics.
I'm Hispanic. My BMI was a little higher than it should have been. And just family history. My dad is diabetic.
Brenda says she was disappointed with her diagnosis, but she quickly learned gestational diabetes can affect many pregnant women.
Usually caused by the placental hormones, changes in the hormones.
At the Community Diabetes Education Center, she was put on a path to help her control her diabetes.
You want to deprive your baby of all the good stuff.
Patricia is also a certified diabetes educator. She says Brenda has been encouraged to exercise.
Any kind of physical activity is a good way to bring blood sugars down as well.
And she was put on a meal plan developed by Community's dietitians.
We talk about the timing of the meals. We talk about basic carbohydrates and how to balance your meals, how to combine your meals. In other words, not just eating carbs or not just eating, certain foods, but you have to have pretty much a balance. You have to have vegetables, you have to have protein, you have to have some carbs.
No, I've learned to focus on myself. So I have my meals, my 3 big meals in the day, and my 3 snacks, and I'm constantly making sure I know what I'm eating, what's in the food that I want to put in my body.
Brenda also checks her sugars between 4 to 5 times a day. Patricia says uncontrolled gestational diabetes can have damaging effects on both mom and baby. Babies may have problems with breathing, jaundice, and may have low blood sugar at birth. Babies can also grow at a faster rate, and a larger baby can cause mom to have a complicated delivery.
Actually see.
Brenda says she's grateful for what she's learned at the Community Diabetes Education Center, not only for herself, but for her baby.
I will keep this diet here on after, even after baby's born, modifications, and just being more, having a more active lifestyle as well.